We have with us Dr. Deepak Chaturvedi, MD Medicine. We have a huge number of people ourselves that need to be vaccinated. If I could just quickly go over to Dr. Chaturvedi. Dr. Chaturvedi, do you think we have the logistical infrastructure to then cater to this huge demand, demand for the COVID vaccine itself? I mean, are we prepared for it?
So first of all, I would like to thank Dr. Jayadevan for a phenomenal explanation. Thank you so much, Dr. Jayadevan. Now let me come to the question, logistics. So I'm a bit skeptical in saying that, and sorry if I'm getting a bit pessimist. India yet to develop that sort of infrastructure.
That's all right, sir. I mean, the situation is completely pessimistic. It's been pessimistic this whole year.
Where we can really percolate the vaccine to the grassroots level, and I'm talking about the last citizen in the remote village of India. But having said that, we have done pulse polio, and government has set up the system at place. It will surely take time, like Dr. Jayadevan told, that it is not something just like a cakewalk. It will be an Herculean task for Indian government or Indian system to administer this COVID vaccine to the last citizen of this country. But more important than this, I would like to comment here. Before the vaccine has come, it is already an anti-vaccine group is very, very active in the global world. So convincing people to take vaccine is going to be a bigger task than delivering the vaccine. And we as doctors, we have seen that we have faced lot of resistance in people when even we talked about polio vaccine, or we talk about DPT vaccine, or we talk about even influenza vaccine to the elderly. So I think that is going to be a bigger challenge for the system to make people understand that they have to take the vaccine, the consent and the willingness of people to take the vaccine.
Right. But this administration, I mean, is there some sort of training that will have to go into the administration? We really need to be getting ahead of our expected goal here. And if I could quickly go over to Dr. Chaturvedi again. Dr. Chaturvedi, what do you think? I mean, would the people be willing to get administered with the vaccine, considering all the side effects that are being put up and are under question and under scrutiny?
So here comes the role of the doctors, role of all of us to educate people about it. If we talk about vaccine, yes, side effects cannot be ignored and cannot be ruled out, but we have to make them understand that the side effects of the vaccine will be more like, the clinical symptoms of COVID itself, but it will be much less than if they get a wild COVID infection. So if all of us come together, all the doctors come together, they start training, telling people, and the shows like yours keep on, airing, and people listen to that, then yes, we can overcome this. And it's not that only the COVID vaccine is going to have some side effects. Even forget about the vaccine. Anything what we do has some of the other unwanted or the adverse effects. But we are well equipped to handle them. So if I say mathematically, we will be more equipped and comfortable handling the complications of the vaccine compared to the complications of the pandemic.
Dr. Chaturvedi, you see, I mean, it is being reported that by 2024. The world is going to be, COVID-19 free. So, I mean, if we're keeping that into account, if we're looking towards the year 2024, what should we be expecting from the future? Where do you see all of this go?
See, every pandemic when comes, it has to end somewhere. Okay, so saying that it will end up in 2024, it's quite a realistic and optimistic statement, and we have to move towards it. But having said that, one pandemic gone, other pandemic will not come. Difficult to say, because the virus do mutate, and we can expect any other pandemic in near future too. That is one part of the story. But the more important is the acute intervention at this current point of time. What we have to do. 2024 is still 4 years away from today. Now, like what Ms. Rahmani said, I would like to comment on that part. That India has to now behave like a developed country, and I'm just talking about India right now because your channel is also India. So let's focus on India. Like, let's focus on our home first, and everything else can be, everybody will take care of their homes.
But thank you so much. You rightly said, Dr. Chaturvedi said that what goes around definitely comes back around. You'd never know. I mean, the COVID will end, but you never know when the next line in will come in. But I'd like to thank all my panelists. That's all we have in today's edition of People's Editor. We'll see you again next week. Lots of other news on the other side as well.